Okay, September, National Cholesterol Education Month. We've been doing our part in helping you keep informed on how cholesterol impacts your body. We've been learning so much. This morning, we have cardiologist and board member Dr. Deepak Talreja here from the American Heart Association. And you've been going through the aspect of looking at our cholesterol levels, how they impact our arteries. And you brought another thing here, a stent. Now, we talk about stents. I think people have heard it, but how does it actually work in helping us?
Great question. So as you and I discussed earlier, you can take a normal artery, develop cholesterol buildup that makes the artery narrowed. And here you can imagine the heart's only getting a fraction of the blood that it should.
Right.
And yet it still has to work 24/7. So when a person develops a blockage like this, we first use medicines to try to expand the artery. And if that doesn't work, then there's a little metal coil here. That metal coil can be delivered right through an IV in the arteries, and that lets us put the stent in, expand it, and push the plaque aside to open up that artery. If a patient has a lot of plaque, we think about bypass surgeries where we take arteries and veins from other bodies and bypass around. But getting back to how you started us off, the best solution is not to let this happen in the first place.
It's the prevention.
It's prevention. It's knowing your cholesterol and getting it lower.
Okay, so we were talking a little bit before we even went on here. If you get to this stage, what are the other options to maybe hopefully get back to this? What do you all do in that case?
What a great question. And so in the short run, if you're having a blood clot and a heart attack, you need a stent or a bypass.
Okay.
But if you can pick it up a little bit earlier and notice that your cholesterol is high, we can change your diet, increase your exercise, improve your lifestyle, and we have a ton of great cholesterol medicines that can actually eat away some of that plaque so the artery gets back closer to its normal self.
Now, earlier we were talking about getting tested. How often should someone get tested so that they know? Because you were telling us, I believe, someone may not know they went from that to this because you might not see any signs. So how often should I go to try to catch that?
Great question. Really, we would recommend for most adults, checking your cholesterol once a year makes sense. Now, if you have very high cholesterol and we're adjusting medicines or changing your diet, you might check it more frequently so you can see the impact of what you're doing. And certainly if something changes in your lifestyle, then that's a reasonable time to check it additionally, but really once a year.
When you say changes in your lifestyle, I mean, I can think of a few just of my own, right? What kind of changes are we talking about?
What a great question. So number one, quitting smoking. For smokers, quitting smoking can really reduce plaque accumulation. Healthier diet and lifestyle, less food, less processed food, more fruits and veggies. An exercise program, the American Heart Association recommends 30 minutes of exercise 5 days a week. That's 150 minutes of exercise. All those things can improve the way your arteries work.
So you're telling me I should not go get those bag of chips after this for sure. But, you know, when we talk about lifestyle changes, I'm so glad you brought up like the things that you can try to do. A lot of times people say, I don't have the time, I don't have the resources. What are some of the other small steps that they can take, hopefully, to kind of save their life and their health?
Absolutely great question. And so time is a big constraint.
Yeah.
But the first thing I always tell patients when they say that is, you make a little time now and it's going to save you a lot of time later.
So they don't get to this point.
So you don't get there, and then you have a lot of time spent taking care of your health. But doing things like parking farther and walking at work, taking the stairs more often, simple little things, finding ways to incorporate exercise. After your dinner, going for a walk with your family or loved ones. That's a great activity to talk, unwind after the day, and get to your exercise targets.
I'm so glad that you were able to come in, and it's been great to have the American Heart Association here the last several days. I've learned a lot. I think others have learned a lot. My coworkers have. So thank you for joining us this morning, and hopefully it's going to lead to people living a little bit healthier.
Thank you so much for inviting me.
Absolutely.